you're struggling with ongoing concussion symptoms, you're going to want to stick around for this entire video because we're going to break down the main causes of persistent concussion symptoms. Hello and welcome to our channel. My name is Dr. Cameron Marshall, aka Concussion Doctor from CompleteConcussions.com, and I'm here to help you better understand concussion injuries. In our last video, we discussed what to do if you just had a concussion. These are called the acute phases. In this particular video, we're talking about something called persistent concussion symptoms, which is formerly known as post-concussion syndrome, which is PCS. PCS is when you've had concussion symptoms that last longer than 1 month and can last for years and years and years. And some patients have had concussions for 10, 20, 30 years. But I'm here to tell you that with the right approach, concussion is actually a treatable injury. And in this video series, which is specifically designed for concussion patients, we teach you how you can optimize your recovery and actually heal your brain for good, whether it's been 10 hours or 10 years. So if you're new to the channel, please be sure to subscribe, give this video a good old thumbs up, and hit the notification bell so that you can get access to any of our videos as soon as they come out. Also be sure to leave any comments or questions that you have below. If there's something that you'd like me to cover, certain topics or things you'd like to know about concussions, please comment them below, let me know. And if you know somebody you think that would benefit from this content, please be sure to share it with them. Obviously, concussion is a knowledge-based field, and the more you can share this video, the more people understand this, and the more help we can deliver. So if you're struggling with ongoing concussion symptoms, you're going to want to stick around for this entire video because we're going to break down the main causes of persistent concussion symptoms. Once you know what's driving your symptoms, then you can actually treat it. And that's really the whole idea behind what we're doing here. So before I start, in the description, we have a link to some workshops that I run. These sessions are specifically about how to go about treating these causes. So in this video, we're going to talk about the causes. In that link below, we have workshops that we talk about how to treat those things. No matter how long you've had your concussion, you can actually get rid of it if you know what to do. So after this video, if you want to learn now how to fix your symptoms, make sure you register for one of these free sessions to learn how to actually, fix these underlying issues. It literally costs you nothing. It's absolutely free, and it could change your life. We've had thousands of people come through these sessions, and the stories of success are why we continue to do this. Suffering with ongoing concussion symptoms is completely unnecessary. It's just something that most doctors and healthcare professionals don't understand well. So they can't really help you. And so the unfortunate thing is it's unnecessary, but it happens all the time. So if you've been struggling with ongoing concussion symptoms for more than a month, even up to 10, 15, 20 years, it's not your fault. It's the medical system has just simply let you down and they failed you. So let's dive into this topic and we'll talk about what causes PCS. First of all, the first video in this series was all about what a concussion is and what it does to the brain. If you haven't seen that video yet, then I would recommend that you click on that link that's above my shoulder right here and you start there. In this video, we're going to give kind of a brief overview of what a concussion actually is, and so you'll be able to see a little bit of it, but it might be over your head if you haven't actually seen this video first. So click there, go back and check that one out if you're finding a little bit of trouble keeping up with what I'm going to talk about here. So let's kind of dive into this. I'm going to give you a brief overview of what a concussion is, and then we're going to talk about why persistent symptoms tend to linger. So this image here is kind of a big, broad, scary looking image, but I will break it down. Concussion causes a stretching of neurons, and with that stretching, you're going to get something called an ion exchange. And so potassium, you can see these little K plus things that are outside of this cell here. So these are neurons. These are brain cells. These are two separate brain cells, and this is what's called the synaptic junction here. And you can see that you have potassium ions that are outside of the cell. Normally, these are supposed to be inside the cell. And so what you're actually ending up with here is potassium leaving the cell. So this is the ion exchange that happens. That ion exchange causes what's called a depolarization and causes the neurons to start firing. And when neurons fire, they release a neurotransmitter called glutamate. Glutamate opens up and allows calcium to come into the cell. Calcium affects our ability to produce energy. So calcium gets into our mitochondria, which is the lungs and the energy production portion of our cells. So what happens is we actually start producing less energy because it kind of gums up the system. So ultimately what happens in a concussion is you get hit, you get this stretching, which causes what's called depolarization, which is just this electrical storm that happens inside the brain. That electrical storm leads to calcium coming into the cell and affecting our ability to produce energy. So what happens after concussion is you get this massive drop in energy because we're burning more energy than we're producing. And ultimately that is what happens for the first few weeks after concussion is you end up with this massive metabolic, they call it a neurometabolic cascade. So you end up with this massive energy deficit. So this right here is a study that was done looking at these energy levels in human with this experimental technology called magnetic resonance spectroscopy, which is kind of an MRI technology. These are research tools. We don't use them clinically, but you can see here that you have this massive drop in energy. Day 3, you're way down here, and then 15 days after concussion, you're still coming back up. 22 days, you're still coming back up. By 30 days, you can see that there's these single stars here. The single star has disappeared by day 30, meaning that there's no more significant difference between the group over here, which never had a concussion, and 30 days after concussion. So the recovery of a concussion from a metabolic or brain standpoint is about 30 days. Now, beyond 30 days is when you get into PCS. This is why the diagnostic criteria kind of lines up with this, right? So after 4 weeks, if you still have symptoms, you're now called PCS or persistent concussion symptoms. And this can literally go on indefinitely, right? The longer it goes, the harder it is to get rid of, but it doesn't mean that you can't get rid of it. It just means that there's more work to be done because there's underlying issues that have yet to be addressed. So symptoms lasting longer than 4 weeks, this is roughly 30 to 40% of concussion patients will go on to do this. Now, if we do treatment early on, we can prevent this. And if you're already in this state, we can actually treat it and get rid of it. So first, we're going to talk about what the causes of this are. So there's 5 main causes. Number 1 is dysregulation of the autonomic nervous system. I'm going to break each of these down as well, just kind of give you an explanation. Number 1, dysregulation of the autonomic nervous system. Number 2 is inflammation of the nervous system, which also pairs with hormone dysregulation. So the hormones that are produced within our brain and within our organs can get a little bit out of whack after concussion injury, and that can cause a whole bunch of different symptoms. Visual and vestibular dysfunctions. Vestibular is your balance system, so that those things can be kind of out of whack. Your neck. So when you get a concussion, you also get a whiplash injury, and there's a lot of overlap between neck dysfunction symptoms like dizziness and headaches and visual problems. A lot of that can be driven by neck injury, which happens simultaneously with concussion and takes longer to recover. And then finally, number 5 is the mental health aspect of this, right? You've been told not to work, you've told to take time off, you're on, disability maybe, you've lost your social network. All of these things tend to compound. They can create anxiety, social isolation. You can have maybe trauma, post-traumatic stress from maybe a motor vehicle accident, maybe spousal abuse. There's a whole bunch of different reasons why there could be a mental health component to this. And the treatment of concussion historically has been telling people to rest and do nothing. Well, that can actually make you depressed and anxious on its own. The concussion injury can also make you depressed and anxious by itself. So if you take a concussion injury, which can do that, and then you take the treatment that we usually give to people, and that makes things worse. And so depression, anxiety, post-traumatic stress all lead to the same symptoms as concussion. So a lot of times patients that are struggling with really long ongoing symptoms have a lot of anxiety that's driving their symptoms, or a lot of depression that's driving their symptoms. Now, healthcare professionals may have told you this before, and usually people take that and internalize it as the doctor thinks it's all in my head. And that's not what I'm saying here. What I'm saying here is that mental health conditions like anxiety, depression, and post-traumatic stress are barriers to recovery, but also mimic the exact same symptoms as concussion. So if we're not addressing that and not considering that, we're actually missing out on a huge component which could be driving many, many of our symptoms. So the good news is that each of these is actually treatable. All of those are treatable. You just got to find out which one or ones are driving your symptoms, and then you can fix it. So let's dive in to these things, right? So the treatment of this is actually quite simple, right? It's not, it sounds complicated, and it is kind of complicated, but the idea behind it is find the cause and then treat that particular cause. That idea is actually quite simple. It's not easy though. It actually takes quite a bit of work. So I don't want to confuse those two things. Let's talk about autonomic dysregulation. So your autonomic nervous system has two components. You have a sympathetic side, which is your fight or flight. It's when your nervous system is, oh my God, there's a bear chasing me. Your pupils dilate, so you let more light in. Your ears get more sensitive to noise and things around you. Your blood flow starts pumping. Your heart starts pumping. It moves blood to the working muscles, and it takes it away from the organs so that you're purely in fight or flight survival mode at this point in time. What happens on the other side of the spectrum is what's called your parasympathetic system, which is your rest and digest. This is when everything's taking it easy. There's no stress. You're able to increase saliva production. The blood flows to your organs so that you're able to digest and kind of move things through your body. Blood moves away from your muscles. Your pupils constrict because they don't need to be so sensitive to light or noise. Okay. After a concussion, your sympathetic side goes way, way, way up. Right? These things usually operate on a teeter-totter. So when your sympathetic side goes up, your parasympathetic side drops, and vice versa. What happens after concussion is, boom, we end up in this sympathetic state. So our pupils dilate, which means we may become light sensitive because there's always so much light hitting our eyes. We may become noise sensitive. There's so much sound hitting our ears, and we don't need to be noise sensitive, but we are now because of this, right? And it disrupts our ability to move blood around our body. So what happens is we become exercise intolerant, where exercise makes things worse. Cognitive thinking makes things worse because we're not able to get blood to the right places because our autonomic nervous system is not regulating properly. So this teeter-totter gets out of whack. So after concussion, sympathetic dominance. So this affects blood flow, digestive issues. Some people will say, I've had like this upset stomach. I can't tolerate things after my concussion. And the reason is because your autonomic nervous system, right? Fight or flight versus rest and digest, you're not digesting properly, which also then leads to the next one, which is inflammation. Autonomic dysregulation can cause anxiety issues, sleep problems, hormone imbalances, and also cognitive and thinking problems. Next one is inflammation. Okay. After you get a brain injury, there's a thing called the gut-brain axis. Brain injury within 3 hours is already increasing the permeability of your gut, which means that things that shouldn't be getting into your body start getting into your body through your gut lining. And then what happens is your body mounts an immune response to that. So it attacks it. That is inflammation. Inflammation then travels up to the brain and makes you foggy, tired, you can't concentrate, headaches. All of these things can be driven by an inflammatory cycle through the gut-brain axis. So a big component of inflammation is the foods we eat, the stress we're under, right? Thinking about the autonomic nervous system and our ability not to digest properly. After a while, we also start to see hormone imbalances where we have dysregulation in adrenal function. We have dysregulation like, cortisol. We have sleep problems. All of these things can be related to chronic neuroinflammation and the autonomic dysregulation that occurs. Now, the treatment for this is generally through the gut. If we can fix and heal the gut lining, we can stop the cycle and potentially reduce the inflammation, which makes us feel more alert, clear, less foggy, less headaches, etc. So that's one kind of component to this. Next up, we have the visual and vestibular system. This one's pretty self-explanatory. If your eyes aren't telling you the right information, sometimes people are motion sensitive, right? You go to a grocery store, it's just chaos. There's too much going on. The lights, that can be an issue. Vestibular is your balance. Maybe things start to spin on you. Maybe if you roll over the wrong way, everything starts to go crazy on you. So your visual and vestibular systems communicate with each other to tell you where you are in space. And if one component is off, it's going to make you feel like you're disjointed and you're not quite there. The other component to this, between visual and your vestibular, which is your inner ear balance mechanism, is actually your neck. Your neck tells you also a lot about where you are in space. So there's these three systems, visual, vestibular, and neck, need to be telling you the same information. If they're telling you the same information, then everything feels fine. But if your eyes are saying that everything is level, and your ears are saying that everything is level, but your neck is really tight on this side, so it's telling your brain that your head is tilted, when it's not, your brain's going to go, wait a minute, who do I believe here? The eyes are saying one thing, the ears are saying something else, saying the same thing, but the neck is saying something completely different. So you feel this disconnect where you feel like maybe you're on a wave. Sometimes people will feel like the ground is kind of moving around them. Sometimes people will feel they're being pulled to one side. These are many times actually neck issues that haven't been properly addressed. The symptoms of concussion and the symptoms of whiplash are actually identical. And if you put them side by side, which I have done right here, you can see that they are identical. Concussion takes 70 to 120 Gs to occur. Whiplash only takes 4.5. So anytime you get a concussion, you're also going to get a whiplash at the same exact time. The symptoms of those two things are identical. So let's say the concussion recovers after 30 days, but the neck injury is still there or hasn't been addressed. Guess what? You're still going to feel like you have persistent ongoing concussion symptoms, but you actually have neck dysfunction. Okay? So all of these things are potential causes of persistent symptoms, right? But if we were to get the right care for the neck, it goes away. Right? So we have to think about what's the cause, what's driving my issues. Now, if you go and get neck treatment and it doesn't work, it's likely because you haven't addressed the autonomic system, you haven't addressed the inflammatory system, you haven't addressed the visual vestibular system, you haven't addressed the mental health system. So you kind of have to go through the process of doing all of these in the proper way and the proper order. Otherwise, it just won't work. And most healthcare professionals have no idea about this stuff. So they end up misguiding you, really. You end up going to vestibular treatment, that didn't work. I end up going to vision therapy, that didn't work. I end up going, here, that didn't work. I'm on this medication for my headaches and that's not working either. It's because nothing's been done in the right way, right? You haven't done it in the right order. Like I said, there's a link in the description below that discusses this in our workshop. So come to one of our workshops, check it out, and you'll see exactly kind of how to do this in the right way. There's a proper order to this, to do things in a proper way to help you get better. Now, let's move on to number 5. Number 5 is the psychological. I've already kind of covered this. I have a picture on the screen here of something called default mode interference. The default mode network is your self-talk, the little voice inside your head, right? It's your ego, it's your sense of self. It's, what do I got to do later? That's your default mode. Okay. Your executive network is the network that your brain function that is working on a task. So as I'm sitting here speaking to you, I'm only thinking about what I'm going to say next. I'm really dialed in on what I'm speaking about. That's your executive network. What happens after a concussion is you get something called default mode interference. So when you're trying to focus on something, your little voice, your little ego starts chipping in on it. And so what happens is you can't focus because you get distracted by your little voice. What happens there is you have decreased cognitive function where you're not able to focus, you get distracted easily, you're kind of spinning in circles, you're listening to a conversation, but all of a sudden you lose the conversation. And we attribute this to being a cognitive problem, right? My brain isn't working well. But we also see the same problem in people with anxiety disorders, people with chronic stress and post-traumatic stress. And so a lot of times this actually could be attributed to more of mental health, right? If we have chronic anxiety about not being able to remember, not being able to focus, what starts to happen is during a conversation, when we're trying to focus, we start thinking, oh my God, I can't focus. And when you start thinking, oh my God, I can't focus, you're not focusing. And so what happens is you start to think, oh, again, see, I knew it. My brain is messed up and I'm not having the right response here and all these things, right? So mental health is a big component of concussion recovery. And if we don't address mental health, we can't address the other components. And so I always include this. And a lot of times this comes down to just purely education. And if you've had symptoms for that long, if you've had symptoms for a month, 2 months, 3 months, 6 years, guess what? You're going to have some components of anxiety, stress, depression around this, and those can become barriers to your recovery. And so I always will include mental health as one driver of concussion, persistent concussion symptoms. So let's just kind of summarize to break this down. Concussion is a short-term energy deficit. It is not long-term brain damage, right? A lot of people think that concussion causes brain damage and that's the end of it, right? There's some evidence or speculation that concussion may cause what's called microstructural injury, may kind of damage some of the neurons underneath the surface. But if you look at concussion on MRI or CT scans, the brain looks normal. There's no physical damage to the brain. And this is what separates concussion from more severe forms of traumatic brain injury. Now, after 3 to 4 weeks, the energy deficit has recovered. Beyond that is what we're into post-concussion syndrome or persistent concussion symptoms. All of the things that cause the symptoms of persistent symptoms are treatable, okay? The problem is that healthcare professionals don't have any training on this. And the research is being done right now, and the things that I'm showing you right now will take 15 to 20 years to make it into clinical practice. That's just the reality of the situation. Research happens, and it's not till 15 to 20 years later that we actually see what that looks like in real life, okay? So most of what I'm telling you right now, your doctor will not be implementing for the next 15 to 20 years, which is actually quite scary. But concussion, like I said, is 100% treatable, and I hope that this video helps to kind of frame the potential causes of persistent concussion symptoms. Now, if you want to know how to treat those symptoms, like I said, check out the link in the description below. Sign up for one of our free workshops, because then we go in depth on how that is done. If you found this interesting or valuable, please be sure to share it with a friend, and also like, subscribe to the channel, and all that good stuff. I'm here to try and help concussion patients to recover from these injuries, because like I said, it's completely unnecessary, and there's very few people that understand it to this level, and that's why I'm trying to give patients the power in order to be able to kind of take that information and help themselves. Anyway, thanks for joining. I hope you enjoyed this.